Hello, my name is Sarah Boyd, and I'm the president and founder of Operation Truth Vaccination Exposure Research. During this week, I've shared a couple videos of how lymphedema presented in my lower body and how I was able to connect my lymphedema to the anthrax vaccine by conducting my critical root cause analysis. Today's video, I will discuss what lymphedema is and how to effectively treat your lymphatic system. According to the Mayo Clinic, lymphedema refers to tissue swelling caused by an accumulation of protein-rich fluid that's usually drained through the body's lymphatic system. It most commonly affects the arms or legs, but can also occur in the chest, abdomen, neck, and genitals. Lymph nodes are an important part of your lymphatic system. Lymphedema can be caused by cancer treatments that remove or damage your lymph nodes, or any type of problem that blocks the drainage of lymph fluid can cause lymphedema. Lymphedema signs and symptoms include swelling of part or all of the arm or leg, including fingers or toes, a feeling of heaviness or tightness in the affected area, restricted range of motion, recurring infections, hardening and thickening of the skin, which is fibrosis. Signs and symptoms can range from mild to severe. In my case, my symptoms began in 1998, less than 2 months after receiving my basic training vaccinations, presenting in my body as bilateral leg edema or swelling in both of my legs, to the point of having absolutely no ankle definition. From there, the edema spread to the remaining locations of my body as a result of the damage caused to the lymph nodes, causing the lymph nodes to become hardened in several areas of the main drainage points of the body, including the groin, axillaries, and neck, blocking the drainage of lymph fluid, creating another level of toxicity in the body, causing the body to no longer be able to extract the critical toxins from the cellular waste that our body's cells produce. Presenting in my body as either full edema in both my legs, arms, torso, neck, and face, or when the affected areas have less edema, the skin appears loose, extremely scarred, and discolored as a result of the irreparable cellular damage. As a direct result of the vaccine side effects, my lymphatic system was damaged on a level that even the top specialists do not understand. The hardened lymph nodes are a direct indication of irreparable damage. There is hope for proper treatment to live a productive and healthy lifestyle. According to Johns Hopkins Medicine, the most effective tools to combat your lymphedema are the following. Clean the skin of the affected limb daily and apply lotion. When drying the affected areas, be gentle but thorough. Take proper care of the fingernails and avoid cutting cuticles. Clean all cuts with soap and water and then apply antibacterial ointment and a sterile dressing. Do exercises regularly to improve drainage, but first consult your doctor or physical therapist. Eat a well-balanced, low-sodium diet. Keep the affected area elevated when possible. Protect the affected area from needle pricks and sharp objects. Avoid vigorous, repetitive movements against resistance, such as scrubbing, pulling, or pushing with the affected limb. Avoid sunburns or other burns to the affected limb. Use an electric shaver when shaving affected areas. Wear gloves when gardening and when using strong household detergents. Do not wear nightgowns or clothing with elastic cuffs. Carry your handbag or heavy packages in the unaffected arm. Make sure that all injections are given and blood tests are drawn in the unaffected arm. If at all possible, have all blood pressure tests done on the unaffected arm. Avoid extreme hot or cold temperatures on the affected arm, such as heating pads or ice packs. And notify your doctor immediately of any signs of infection, such as redness, pain, heat, increased swelling, or fever. Unfortunately for those patients with chronic multi-symptom illness, many of the previously mentioned treatment protocols are not effective or could harm our patient demographic. For example, a patient like myself with autonomic neuropathy needs additional sodium to assist the correct rebalance of the functioning nervous system. The increased sodium intake would be further damaging to the lymphatic system as a result of the lymphedema. Exercising in any capacity is extremely difficult for our chronic multi-symptom illness patients. Therefore, finding an exercise regime that is effective for lymphatic drainage is key. Since dealing with this medical issue since 1998, I have found many lymphatic treatments to be failures. My medical team has tried wrapping the affected limbs or wearing compression garments with no change. I have a personal electronic leg pump that uses air to compress the legs, much like your leg muscles would do in a working system. That treatment failed as well due to the nature of the lymphatic system damage. Massage therapy is a great tool, but not effective against a failing system. Aquatics therapy, rest with elevation, cannabis, and proper nutritional balance are the most effective tools for a damaged lymphatic system. Ensuring your nutrients come from alkaline source whole foods and getting proper rest. For me, that is at least 12 hours of rest, with 6 to 8 hours of that rest being deep REM sleep. Sleep is extremely important for healing the body, especially for lymphatic drainage. There are 4 stages of lymphedema. Stage 1 is an abnormal flow in the lymphatic system, no signs or symptoms. Stage 2 is an accumulation of fluid with swelling. Swelling resolves with elevation. Pressing on the area may leave a dent. Stage 3 is permanent swelling that does not resolve with elevation. Pressing on the area no longer leaves a dent and changes in the skin with scarring and thickening. Stage 4 is elephantitis, large deformed limb, skin thickening with wart-like growth and extensive scarring. I have been currently at stage 3 for the last 10 years. Instead, my body has pitted edema, causing the dents in the affected area to last for hours before returning to their normal appearance. Surgery could be our next option in assisting the lymphatic system effectively to decrease toxicity throughout the body, improving overall health and healing capabilities. As I have stated, this week is the beginning of a series Operation Truth is conducting to show our fellow chronic multi-symptom illness patients how to conduct your own root cause analysis. If you're interested in learning more about your own health journey, then send an email to the contact listed on your screen. Our next week's videos in this series will cover how Raynaud's phenomenon presents in the body and how to effectively treat your Raynaud's phenomenon. Thank you for watching. Stay tuned for further relevant content and don't forget to subscribe. Have a great weekend.